Hello and welcome to the first part of a three-part educational web video series for nursing departments on the Nurseready room model. Part one is what is a Nurseready room? I am Brian Harriott. I'm the CEO and founder at ReadyList Incorporated, a healthware software firm. I'm the former director of hospital operations at UCSF Health. In this three-part video series, first we will review what a Nurseready room is. Then spend time discussing who prepares a Nurseready room and why is it so difficult. And thirdly, how one medical center did implement a Nurseready room. And our mantra behind all of this is the fact that, as is quoted here, nurses should be nursing, not finding and cleaning infusion pumps. So this is most likely a very common scenario that you might find yourself in as a nurse, and that is working in an environment, specifically a patient room, where you can't do your job for one of many reasons. One, perhaps the cleaning is not done correctly, not up to standard. There is the wrong or missing equipment in the room. If you need something, you need to go find it. It's not there in a proactive manner, and it depends upon who you get in terms of how well the room is prepared. Some other situations here are that you have no idea how the department is doing or how support services are doing in terms of setting up the room because there are no metrics. There's not a great relationship between nursing and support services, and it all leads to just inadequate space and equipment and tools necessary to care for patients. This is what we try to solve with the Nurseready room. So now if you allow yourself to dream, this is the situation we want to allow ourselves to be in. We want to know that the cleaning protocols are consistent and up to standard. We have specific equipment, potentially to even the unit or the type of room on that unit. We have standardized operations so that no matter who sets up the room, it's always perfect. And we have support service departments that are interacting well and working with nursing, providing detailed metrics to see how improvements are being made. And the result is just an incredibly suitable environment for patient care. So as I understand the lay of the land of Nurseready rooms, I see three models. One that is a baseline or kind of a bare necessity that some of you may still see some benefit from. And then the expected level, which I'll spend most of our time in, and the next two videos in our web series are focused on the expected model. And then there's the delightful model, which I haven't yet experienced, but I've heard about, and it's very exciting. So in the baseline model, essentially what we have are, paper-based checklists that environmental services uses to guarantee that all critical care rooms are set up the same way and all med-surg or acute care rooms are set up the same way. And not just that, but we will add to that the fact that your equipment rooms and your clean storage rooms are also kind of cleared of clutter. Everything is in its place. It's labeled and you know where things are so that you can get them. I think with these two things, you are actually much further along than a lot of scenarios that nurses find themselves in. This is a very cost-effective, relatively easy in terms of complexity, ability to provide some value. I'm going to be including additional tools, resources on a web page link that I will indicate later in the presentation. And what I will include for this model are these two paper-based checklists for critical care and acute care rooms, as well as some techniques around Lean 5S, which is describes the ability to set up and stage a well-organized equipment and supply room. Now the expected model. This is very nice. The idea here is that you have digital or electronic bed turnover checklists that environmental services and material services and other support services are using together to set up a room specific to the unit or even specific to a type of room on the unit. So for example, if you have a labor and delivery room and you want 4 pillows on the bed, it's clear there are 4 pillows. Whereas if you're in a critical care room and you need only 1, there should only be 1. It's down to that level of specificity. We have equipment flow that's aligned with the room setup. So for example, as environmental services is setting up the room and they realize that there's not a piece of equipment there, an infusion pump, it doesn't just go missing and you have to deal with it. It's identified, called in, gotten up to the room before the room is even turned over. And not only that, but each support service department has a scorecard and metrics from which they can continue to improve. Now, this is certainly more expensive than the baseline model, but not that expensive. It's got medium complexity, mainly in terms of the change in workflows that allows support services to give up or take on responsibilities to work better in a streamlined manner. And it's got significant value. The tools and resources that I'll provide for this model are a standard best practice nurse ready room workflow, as well as what a sample departmental report would look like for improving service. Now, the delightful model is something that you may or may not experience in your career. This is where you are able to do a full remodel, capital dollars being spent to allow patient rooms to be not only redone to be more aesthetic, but also designed in such a way that nurses are able to have the right workspace in the right location and the right amount of it, so that all of the workflow changes in the expected model can also follow suit. High cost, high complexity, but really high value. I will link to a lean-based design article on the website. Now, you might wonder, why is there a duck on this slide? I think of the nurse-ready room like a duck swimming. You know, to the outsider or to someone not familiar with what is required to happen, it looks smooth, it looks clean, it looks streamlined, but that's only because of what's happening under the water, right? And under the water are very hardworking support service teams working together well to make sure that everything is set up appropriately. Now, we will talk more about in video series, video part number 2, about how to guide that work of the support service teams, and then in part 3, how a medical center was able to do that and produce a strong nurse-ready room model. So thank you very much. Please visit nursereadyroom.com. And that's where I will link to some of the other tools that I mentioned inside this video. And I look forward to, you can look forward to hearing from me again in videos number 2 and number 3. Thank you.